This is Libby, and today I'm going to be looking at the first topic in history, medicine in Britain, looking at supernatural and religious explanations. So, superstitions about disease in medieval medicine. Alongside natural causes, doctors believed that supernatural causes could lead to illness. Some of the things that were believed to cause disease were, first of all, God. Many people thought that illness was God's will. If someone did something bad, such as committing a sin, God could punish them with illness. Prayer and repentance were thought to be a way to make a person better after an illness or disease. To repent for the bad deeds, many used prayers or flagellation, which is whipping of yourself. Another potential cause of disease were witches and spirits. Some people believed that supernatural spirits could live inside a person and cause illnesses. Some people in the church did exorcisms to get these spirits out of people's bodies, and witches were also thought to be responsible for some diseases spreading across a town. And the third cause is astrology. These supernatural reasons were based on astrology, which is how the stars and planets were aligned. Astrology was first used in Arabic medicine, but it was used in Europe after 1100. Doctors used star signs in an almanac, which is a calendar showing planetary movements, in order to diagnose and treat diseases. So, to look back over those three causes, we know that astrology and medieval medicine, it refers to the supernatural reasons which were based on astrology. And astrology was first used in Arabic medicine, and it was used in Europe after 1100. And the calendar, which was showing these planetary movements, was called an almanac. The contribution of Christianity. The Christian church had a mixed impact on medicine in Britain. So, supernatural causes. The church promoted the belief that illness was because of supernatural causes. Because of this, Christians believed that God would heal illness. Prayers were viewed as the most important kind of treatment, and Christians would go on pilgrimages to relics or to the resting place of saints in the hope of miraculously recovering from illnesses. Forbade dissections. The church only allowed dissections to happen on criminals that had been executed. This meant that Galen's mistaken beliefs about the anatomy, which are holes in the heart and blood being absorbed, not circulated, could not be corrected. Here, religion and superstition slowed progress as they weren't able to undergo these dissections. And wars. Some historians have claimed that the church's encouragement of the Crusades diverted or moved funds away from hospitals and health towards the wars. However, the Crusades meant that Western Europeans met Muslim doctors, and this meant that ideas from the Islamic Empire could be used in Europe. And finally, medical writings. Lots of ancient Roman and Greek medical texts were lost when the Roman Empire fell. Monks tried to copy and preserve these medical texts. Dissent began to be caused by people questioning the church's reliance on old books. For example, a monk called Roger Bacon was arrested for challenging the books in the 1200s. So, to look back on the supernatural remedies, we know that Christians believed that God would heal illness, and that Christians would go on pilgrimages to relics or to the resting place of saints in the hope of recovery, and that prayers were viewed as the most important kind of treatment. So, continuing on with the contribution of Christianity to medicine, by following Jesus Christ's example, Christians believed that helping the sick was a Christian duty. Monasteries were usually hygienic and had clean water and good sewage facilities. Because of their religious beliefs, the church promoted the creation of hospitals. Hospitals were funded by the church or aristocratic patrons. These hospitals were usually overseen by priests, not doctors. Hospitals were designed to help look after the sick, not treat and heal them. Most medicine in medieval times was palliative. This means it relieved the symptoms, but it didn't actually cure the condition that was causing these symptoms. For example, Bedlam in London was founded in 1247 to look after those with mental illnesses. People with leprosy were isolated in lazar houses. So, to recap on what we've just learnt, we know that Bedlam was to look after patients with mental illnesses. People with leprosy were isolated in lazar houses, and Bedlam in London was founded in 1247. And we also know that monasteries usually had good hygiene and running water. So to look back on the supernatural remedies that we talked about earlier, we know that Christians believe that God would heal illness. We know that Christians would go on pilgrimages, which are long journeys to relics or to the resting place of saints in the hope of recovery. And we know that prayers were viewed as the most important kind of treatment. So, as we'd already discussed, astrology was an important component of medicine during the medieval England. Doctors used star signs and an almanac to diagnose and treat diseases. Hospitals were designed to help look after the sick, not treat and heal them. As we know, most medicine in medieval times was palliative, which means to relieve the symptoms and not cure the condition. And most of these hospitals were overseen by priests. The hospitals were funded by both the church and aristocratic patrons. So we know that the church potentially slowed down dissections. The church slowed progress by forbidding the dissections. The church also only allowed dissections to happen on criminals that had been executed. And Galen's belief about blood being absorbed, not circulated, was not corrected for many years. So the superstitions about disease in medieval times, there were three, as we discussed: God, astrology, and witches and spirits. Okay, so that's all we're going to be talking about today with regards to the supernatural and religious explanations. Thank you for listening.